All right. Hello, Mansfield Senior Center. My name is Molly Siri. I am a first year pharmacy student over at the University of Connecticut School of Pharmacy. I am presenting this presentation for you today on brain function and drugs, drugs to look out for, and how to ensure optimal brain function. This presentation is brought to you by SCCP, which is the Student College of Clinical Pharmacy, a student group over at UConn. And I would like to note too that the research for this presentation was done by myself as well as Anaga Gogate. Okay, so we're going to do a three-parter today. First, we're going to talk about exactly what we mean by impaired brain function. Important to define it before we talk about what can affect it. So once we do that, then we're going to talk about drugs to look out for, the ones that can be considered most at risk to decrease brain function. And then finally, we're going to talk about what we can do to ensure optimal brain function. All right, so what exactly do we mean by impaired brain function? It's kind of a weird term, but we're going to define it as a decrease in memory or cognitive function. This happens as we age to some extent. It's considered normal. However, there are symptoms that can be indicative of certain diseases, such as dementia or Alzheimer's. Some medications can also temporarily cause this effect, can cause a decrease in memory or a decrease in cognitive function, which leads to impacting qualities like mental acuity, ability to focus, and ability to pay attention. It's important to note, though, that these medications, while they produce symptoms that are similar to diseases, they do not cause the diseases themselves. So the meds that we're going to talk about later, aren't causing things like dementia and Alzheimer's, even though the symptoms can be similar. Okay, so the symptoms that we're talking about, we're looking for things like confusion or drowsiness, short-term memory loss, decrease in verbal ability or reasoning, lack of planning or problem-solving abilities, dizziness, or hallucinations. Basically, all symptoms that, no one ever wants to experience. Okay, so again, too, what's the difference between medications and diseases that decrease brain function? Just like we talked about, the medications that affect brain function have a temporary effect only. So the symptoms are going to occur while someone is taking the medication. As soon as you take away the medication, then the symptoms, should start to taper off and eventually go away. Diseases, on the other hand, have long-term effects. So they could get worse as things go on. They can be incremental. And basically, they're going to be there. They're not going to go away, unfortunately. of medications, which actually is a list that specifies medications that should be avoided in older adults. These medications specifically put older adults at risk of things like delirium, falls, fractures, and motor vehicle accidents. They're things that we really don't want our older adults to experience. So there's a couple examples down at the bottom. The brand name of the medication is in bold. So we have things like Valium, Klonopin, Ativan, Xanax, and Restorel. Okay, we also have some over-the-counter medications. These drugs are part of a class called anticholinergics, and they cause older adults to experience side effects such as fatigue, dizziness, and confusion. So we have things like Diamode, Zantac, and Dimetapp. It's important to note here that Zantac has actually been removed from the US market as of April 2020. So if you do have any still kicking around, you should probably get rid of it. That would be my recommendation. Okay, antihistamines. These medications are used to treat allergy symptoms. They inhibit part of the body's immune response called histamine. While they work differently from medications that we talked about previously, they can cause similar symptoms, such as sedation and loss of mental acuity. Some of these medications are also over the counter, so they kind of overlap with what we just talked about. So things like Benadryl, Claritin, Chlortabs, Cyproheptadine. I want to note too that Benadryl, even though it's listed on here, it's used to treat severe allergic reactions. So obviously, if you were in a situation where you needed Benadryl, you should obviously consider that and most likely take it depending on what the doctor says if you're experiencing a severe allergic reaction. Okay, we also have antidepressants. So obviously treat things like depression or psychiatric symptoms. As compared to what we talked about previously, they cause similar symptoms such as tiredness, dizziness, and confusion. And some of these can also lower blood pressure, which can increase the chances of a fall or a fracture, which obviously we do not want. So you might recognize some drug names on here too, such as Elavil, Paxil, Remeron, or Deserol. Okay, also medications that help with urinary incontinence. So, help patients to better able to manage their urine output. So similar symptoms as what we talked about before. And these are also all listed on the Beers criteria of medication. So again, should be avoided if possible. So we have medications like Ditroban, Detrol, or Vesicare. Okay, anti-insomnia medications, so helpful for treating insomnia, helping patients get to sleep. These medications you might notice we also talked about on the antidepressant slide. These medications, have an overlapping effect with antidepressants, so could be used to treat both things. Okay, so we have our opioids to treat pain. While they are not on the Beers criteria for medications to avoid, they still should be used with caution. And the risk versus benefits should be discussed with a doctor before taking. They can cause similar side effects as to what we talked about before. You might recognize some of these drug names, such as Ultram, Demerol, or codeine. Okay. While we might not necessarily think of things like alcohol or marijuana when we think about drug use, they are really important to consider in this category. They can have effects that are similar to all of the medications that we talked about. But if you're taking any of those medications and then you're also taking alcohol or marijuana, they can have some of an additive effect. So they can impair your memory even further, alter your function, even worse than if you were just taking the medication alone. You can also experience decreased motor skills, things that you really want to avoid if possible. Important to note here too that if you're using medical marijuana, that also has its own risks and its own benefits. So before you consider using it for something, you should really talk to your doctor. Okay, so if you noticed any of the side effects that we just talked about previously, whether or not you are taking a medication that was mentioned, super important to talk to your doctor or a pharmacist. They can check on, the medications that you're taking. They can check up on your symptoms. They can suggest an alternative treatment. There's a lot of things that you can discuss with them. So super important, if you're experiencing any sort of side effects, or even if you aren't sure if it is a side effect or not, better to talk about it, than not mention it. Okay, what can we do to ensure optimal brain function? So basically, we're gonna focus on two goals here. Our first goal is we're going to avoid the drugs that we mentioned previously that contribute to cognitive impairment. Again, super important to, talk to your doctor. Maybe if you are on one of the medications that we talked about before, they can switch to, one that's doesn't have as many side effects or could potentially have, as many symptoms. But what we can also do ourselves individually is we can, promote and focus on non-drug lifestyle habits to, work on our mental wellness. So there's a couple of things we can do. We're going to start with sleep hygiene. So if you're sleep deprived, that can definitely give the effect that, you have symptoms like what we talked about before, the tiredness, the dizziness, the confusion. So what we want to try and do is we want to try to avoid using technology with screens. We want to avoid that blue light that comes from, watching TV or being on your phone, your computer, that type of stuff. We want to develop a regular sleep schedule, and we want to avoid napping or eating large meals too close to bedtime. Okay, we also want to focus on a healthy diet. We want to focus on meals with a lot of fruits and vegetables. Before taking any vitamins or supplements, we're going to talk to our doctor to see if those, are necessary or, could improve our diet well-being. We're going to eat food that's easy on the teeth and gums, and we're also going to keep a careful eye on portion sizes. Because I don't know about you guys, but that's what gets me in particular. Okay, so managing other health conditions is also super important. If you have a chronic disease like diabetes, high blood pressure, or high cholesterol, they can really affect more than we think. So it's not just, that high blood pressure is going to affect your blood, or diabetes is just going to affect your blood sugar. They can really have an impact on multiple organs in your body. So taking good care of these conditions can really help you feel better overall. Also important to note here too, that if you are abusing substances or misusing substances, such as alcohol, marijuana, or other drugs, you really want to try and avoid that. Discuss it with your doctor or another healthcare professional. Because again, these can really exacerbate any symptoms that you're experiencing already or cause you to experience those symptoms in the first place. Okay, the last one is going to be to keep your mind active. So in this current pandemic situation, it's the perfect time to practice a current hobby or pick up a new one. So doing things like reading, puzzles, playing games, currently doesn't have any scientific evidence that it helps to prevent cognitive decline, but keeping your mind active by, participating in things like that can help encourage a more active and social lifestyle. And they're also just fun. So I don't know why you wouldn't do that. Okay, I hope this presentation was informative. I wanted to thank you guys so much for your time. If you have any questions, you can email the SCCP group at the address listed on the slide. And I wanted to wish you a fantastic rest of your day.